Today we're joined by Damien Ng. Damien is a thematic expert at Julius Baer with long-term structural investment focus on longevity, well-being, and the future of health. Damien has published several research articles that contribute to the science on longevity and how longer lives are reshaping wealth management. Most recently, and upcoming, he will publish an article together with LSE. Longevity is no longer a niche health trend. It is today a fundamental capital allocation question. Human age has become the largest unbooked asset. People are living longer, but not necessarily healthier. Financial decision makers, healthcare systems, pensions, family wealth planners, and regulators must fundamentally rethink their operating models. Those that did not adapt to the new reality will soon be left behind. So the real investment question is not how do we live forever, but who captures value when society shifts from treating diseases late to extending health spans earlier. So Damien, with this, I welcome you to the podcast, our first ever edition of the Human Performance Club. Thanks for coming. I would very much like you to have a opening icebreaker here. Let's say if I had a drug right here from the Human Performance Club that is proven to make you live healthy for 200 years, would you take it?
First of all, thank you very much, Jan, for the invitation to come to your club today in St. Gallen. It's a pleasure for me to be here in St. Gallen from Zurich. Back to your question, it is a very fascinating question. You know why? Because if I were given, or if I had the chance to take this drug that could make me live, for example, like 200 years old or 300 years old, the question that I have in my mind is, first of all, will life get boring? That's one thing. And what kind of implications this will have others? Of course, it's not just about for myself, but also for the rest, like for society, for companies. Then there are other questions that come into mind. Say, for example, let's start from society, right? I mean, when it comes to pension, when it comes to the country level, how the government, how they're going to sponsor people, maybe there's still like the intergenerational gap between the older people. I mean, the elder. I wouldn't use the word older people. I would say the adults, older adults, and that of younger people. And then you also have the much more maybe broader, much broader. I mean, what kind of impact that have on let's say, for example, like people who have no good intentions for the world, right? So that might actually not be very sustainable over the long term, for example, when it comes to conflicts and so on and so forth. So I am of the view that it is very good to actually have the concept that we can actually live longer, but it's important to live actually healthier. Right. And very importantly, it is actually to live longer with a purpose in life. Because without a purpose in life, I mean, of course, there is actually the concept of optimization using tech to prolong our life. But at the same time, it is not just about tech optimization. It is also about, say, the orientation, how we want to move forward. Is it actually from just the physical aspect of our body, I mean, the physical aspect, or is it something actually much bigger, say, for example, like the mental part of it? So actually it calls into lots of questions, to be very honest, actually, with this very simple but difficult question.
Full on opening a philosophical debate here. So look how fast we got here.
Yes, exactly. That's true.
So would you take the drug or no?
I don't think I would take it.
Okay, great.
Definitely not, yeah. Mm-hmm.
I wouldn't do so either, I think.
But first of all, maybe just one question actually is that aging is not classified as a disease by the US FDA, which is the Food and Drug Administration. Yes, that's true. You got it right. Yeah. So it is not classified as a disease, right? So this is actually something that we have to take note of as well, of course. Yeah.
Right. I mean, Damien, this takes us maybe to a really important point, I would say, for our audience here as well. let's define longevity. It's such a buzzword, and when people hear it, they often think about biohacking, expensive clinics. From your perspective, what is the most accurate definition?
For me, for my personal self, when it comes to the definition of longevity, it is, as I said earlier, it is something that goes beyond. It is not just about simple optimization of the body using tech, of course. It goes much beyond, in the sense of actually, it is also about health span. One thing, because the focus in the scientific circles, rightly so, it is not just about the part of extending life indefinitely. It is also about the importance of actually leading a life, or that means as long as possible, but free, or at least with no chronic diseases. That's one thing. The second thing for me, longevity is also pretty much about having, as I mentioned earlier, which is having a life purpose or purpose in life that will actually orientate you over the longer term. That's one thing. That's for my personal self. But when it comes to the bank, Julius Baer, or the definition, how we set it, is that when it comes to investment opportunities, it very much actually covers, say, for example, the aspect of, say, healthcare.
Yeah.
Healthcare meaning actually, say, for example, we've got like medtech, we've got like large pharma companies, you've got biotech companies, for example, and you've got also like elderly care, nutrition, financial planning. So this is actually pretty much the entire, the definition, how I would put it on longevity. So to put it short, it is not so much, the focus is not very much put on, say, longevity clinics per se, even though I do agree actually that it is something that's happening within the industry, right? This is something, a fact that we have to understand, but our longevity, the definition itself is put on this, as I mentioned earlier. That means the investment opportunities from a stock market perspective, that's one thing. But of course, and also from a personal self, of course, it is also not just about the optimization. Of course, it is about the health span, the prolongation of health span, and at the same time, having a very, a purpose in life that can actually orientate or a person through his lifespan.
Yeah, purpose is indeed very important, and this begs a question: how will we define purpose or think about it when life gets longer, right? But we'll discuss that later on in our discussion today. I think it's a really interesting aspect as well. Now let's maybe go on with Julius Baer. You already mentioned that Julius Baer has a very diversified portfolio, even when you look at health. And the interesting thing is, for me, I guess there's no one formal definition of longevity. So everybody has like their own kind of definition on it, but maybe what is the biggest misconception? Let's start with the misconception. Would you say that investors have when they look at longevity?
From my experience, a lot of investors, they tend to ask a few typical questions. First, some investors think that, when it comes to investing in longevity, it is all about just biotech. It is all about, like, say, trying to manipulate the cell level, molecular level of a person's health, and then try to prolong life forever. That's one thing.
Classical biohacking, right?
Exactly. That's that one. Others, some actually, they do think actually that, when it comes to longevity, it is all about, say, the importance of going to clinics to actually optimize their health through different methods. So this is actually also some of the longevity. Of course, there are some methods or some of the strategies that each individual adopts to improve their lifespan or health quality, let's put it this way. But some investors do think actually that there are aspects of some misconception that longevity is all about biotech, or either they can actually invest in certain clinics, or some say, for example, like they have to just take some vitamins, and then they can actually chronic diseases are cured.
Supplementation.
So, but there are people who do really ask such questions. But so that's the reason why it's important to have such kind of discussions or such kind of conversation that can help to dispel some of the misconceptions that are around. Yeah.
So yeah, quite some heavy questions that you get from investors sometimes. Huh?
Yes, but some actually are very good. I would say that basically like all questions are great questions. There are no bad questions, because each and every question they sort of opens up for discussion,
right,
for to widen our horizon. I think that's very important. So for me, for my personal self, there aren't any good or bad questions per se from that perspective, right? Because one question can lead on to other type of conversation. So I think that one I really appreciate very much. Yeah.
If you were to say about what opening the horizon, maybe walk us through one of these interactions that you had.
I had a conversation. I was actually invited to Madrid for an event, and the question came to this attendee asked me the question, how do I define the meaning of life purpose or purpose of life, right? Mm-hmm. Because he suggested this. Does it mean that at 8 a.m. when I wake up every day, so I just want to reach out to eat that pack of chips, potato chips? That's his, that is his life purpose. But for me, actually, this is actually very interesting. But it also came up based on that conversation. We had actually a deeper conversation about the meaning of life purpose or purpose of life. I thought it was a very interesting question.
Sometimes it's potato chips, right?
It is. Maybe it's potato chips after all, yeah. But based on that question, we actually developed much more interesting conversation around just on purpose of life, So there was actually some people thinking about, because they want to, they're very happy to inherit or their parents' business, because of their family business. Yeah. Some they actually said that they would like to actually go to certain countries, say for example like in India to do some volunteering work, right, or to Africa, for example. Because that's their life purpose. While others, they can actually be very different, right? So everybody's actually very different. So I feel that there aren't, from that perspective, there aren't really any bad or good questions. In fact, every question could potentially lead on to new or other kind of questions or conversations to be had. Yeah.
Right. Maybe if we're ready to talk about investors, I think that's a really important topic also for a discussion today. Mm-hmm. I am very much interested in the intersection between, investing and now this new field that's emerging, longevity. Mm-hmm. What we see is, many people hear longevity and think of billionaire supplements, people trying to live forever, right? It's just extended lifespan, but I think it goes much deeper than that. Your work focuses on those aspects: demographics, health systems, wealth planning, capital allocation. So when we talk about an investment theme, what is the biggest misconception there that people or investors still have?
When it comes to, let's put it this way. Some investors, when they hear the word longevity, they might think that longevity is all about either investing in biotech companies, but the thing is actually biotech companies very often are at the R&D level. Some of actually the very interesting developments take place at the very early stage of the scientific R&D stage, So that means it is not quite easy all the time for investors to say, hey, I want to invest there, and they want to make profit as soon as possible.
Yeah.
So, science takes time, good science especially,
Right.
It takes time. So investors also have to have patience. That means that when it comes to, there has to be sort of actually like the capital that investors put in they have to be, let's say, for example, with the patience enough for science to develop, to actually create that good foundation for us. So for people who want to invest in the field, they have to really be very, I would say, in my opinion, be very well versed or read up a lot, when it comes to the biotech space, right? I mean, because it takes from the clinical world different. I mean, when a new drug is being developed, so it takes time for that to be commercialized phase, right? I mean, so that is actually a very, very long process, more than 10 years.
Can you even, even with due diligence, is it even possible to get a foundation of what a good investment looks like when it's so much innovation and risk bound to it, right? Because it's intellectual property. So Julius Baer places longevity inside its next generation, right, investment approach, which focuses on long-term structural growth themes. The future health portfolio is built on 4 pillars: extended longevity, genomics, digital health, and healthy living. Which one of these fields excites you most, Damien?
I love all of them. I love all the 4 fields, sub-themes, let's put it this way, because each has their own pros and cons. I would say that as of now, I mean, let's put it this way, I think I like very much genomics. It's very exciting space to be in. First of all, because why I like it very much. I just released a research paper on this in March.
Maybe you could give a quick definition of genomics for our audience.
Sure. Genomics basically is about the biotech side of things. Okay, I mean, to put it in a nutshell for the listeners. So that means actually at the end of the day, it looks into the biotech companies that are involved in this space, I mean, in this investment space. Yeah. So I like this particular space. The reason is because, first of all, okay, biotech is not for everyone, no? Because, I have to mention this. And why I like this particular space is because lots of the very exciting development, as I mentioned earlier, it takes place in the small cap or even to the private company basis. Even though I have to quickly jump in to say that when it comes to our genomics theme is pretty much put on stock market, especially for stocks with a minimum market cap of $2 billion US. Having said that, what I meant actually by the exciting development actually takes place, very much actually often in for example, in the startup space or private companies. Those are very exciting. Why? Because, say, for example, some are increasingly looking to use AI to speed up the drug development process. To me, that is fascinating. It is promising in the sense that because currently, to the whole drug development process takes maybe say 12 to 15 years before a drug, is available commercially for people, for the patients, right? So if AI could play such a role, game-changing role that speed up the whole process, potentially, that means that the new drugs that are available or therapy could be made more readily available for people who need them most.
Yeah.
So that is actually potential out there, right? Of course, we have to take note that the entire process has to go through the entire US FDA approval process, but at least you can actually say that some of the process could potentially be sped up, accelerated. So that could actually be very
There's
game
a lot
changer.
of cool momentum already taking place, right? Google has also already many AI tools in place, Metgamma, another breakthrough technology. When we look at further in the future, I think quantum computing will also play a big role
Yes,
in drug
definitely.
discovery. But let's be maybe a bit more specific. Where in these 4 dimensions of Julius Baer's portfolio do you see the current biggest lever for humanity and civilization that we can make an impact when we invest?
Good question. I mean, has the impact from that perspective? I would say, for example, that's just my thinking. I think healthy living is very important. Why healthy living? Because we always talk about chronic diseases because when we grow older, with age, it grows in tandem with, more and more chronic disease. That's for sure, which is actually happening across the world, right? So that is one point. If we could actually intensify or make sure that people adopt a healthier lifestyle that can help them to prevent or to delay the onset of chronic diseases, I think that is actually very important through, say, for example, through better nutrition, through sports, physical activity, or through, because through sports, it can be actually, say, for example, the use of certain gadgets, for example, to try to, give the to better, for the individual or the user, consumer, to better know how many steps they have done.
Yep.
I have to actually say that because I have been talking to many investors and many people actually who are in the field. Some are strong advocate of using, say, for example, digital gadgets.
Wearables.
Yeah, wearables, for example. Mm-hmm. But some are very against. So, when you deal with a topic which is related to human health, you will have a diverse, or very diverse set of opinions, which is good because that's what human life is all about, right? Because it actually reflects the entire diversity of human experiences. So that's very important. But back to the question, then that's where for individuals who need to actually or would like to actually have, say, for example, the wearables to help them to better optimize their health, why not? Because this is actually, at the end of the day, how this particular individual would like to adopt to better improve their own personal life. But for those others who do not like to use, say, wearables, it's good for them. Because at the end of the day, it is how individuals, they have different paths or different methods for them to how they want to improve their own personal well-being, right, at the end of the day. Same thing for, say, nutrition. Some people think that, they must eat vegetables. Mm-hmm. But some, they say no. And some, they think actually that just by eating, say, more vegetables, or even eating, maybe go to fast food restaurants, because some people are against fast food, but some actually feel that, compared to, say, their previous dietary habit, the meaning of healthier, living is not just about healthy living on the absolute terms, but for them it's already good. So at the end of the day, when it comes to, if we can actually, if the main goal is to prevent the onset of lifestyle-related diseases, I think that's very good. Yeah. Because according to the latest research that was published, I believe, actually beginning of this year, 2026, because they talk about 50% of one's lifespan is basically influenced by genetics, 50%. Because previously, we always thought that it's roughly 20% of our lifespan is affected by our genes. For the rest, 80% it is lifestyle. But when it comes to, according to this latest research paper, it is not 20-80% anymore. It is 50-50%. So 50% is
quite an increase. Yeah,
that is quite an increase. But of course, you never know actually when there are new scientific papers coming out that could actually something be changed. But back to the question on investment opportunities, which is actually very interesting. So if we can actually say prevent the onslaught of certain diseases through better or healthier living, I think that is actually already quite a step forward. Having said that, this is actually an approach for people who would like to say, adopt a prevention side for their health, right? The question next would be, what if for people who already have diseases, we cannot tell the people, hey, why have you not done anything earlier or whatsoever, because then that's where the importance of all these new, R&D, scientific R&D, it plays such an important role. Because at the end of the day, it is not also about people having age-related diseases. It is also about, say, for example, children who are born with certain rare diseases already when they're young, right? So that's how I view things, because I have to say, actually, I'm very happy to be invited here to your podcast. I do not see myself actually as an expert from that perspective. I feel much more it is a privilege for me because of the research that I've been doing on this topic with Bank Julius Baer, that I've learned so much. And from many, many people out there, from the stakeholders, different stakeholders, from medical doctors to scientists, to people who are entrepreneurs, who are nutritionists, or from the wellness space and others on academics. For me, it is very interesting to hear everyone's different perspective. How So when it comes to, say, for example, when I first heard the people's experiences about, it's not just about age-related diseases. It's also about what about for children, right?
Yeah.
So you definitely need all these constant.
Maybe let's go back to the primary question. Let's say, because we talked about different topics now, right? The main thing that I understand is, we have a huge universe of companies that are being founded right now. It's not just we tackle, age-related diseases. Not just we tackle prevention. It's not just we tackle wearables. It's a broad universe here. But still, what I think is so important is that we stay scientific. Grounded in science and truth is so important. And I see many companies, they sprinkle a cherry on the top, like vinegar with the AI, with the blah, 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 blah. It's a lot of bullshit that they sell. Bullshit, I may say that. And I want to hear from you, when evaluating a company in this space, which is so, not only high risk, but important that the product is really something of use, that it's real. What are the first three things that you look at?
I think it's very important for me. Okay, it depends on the type of companies that we are looking at, right? When it comes to, say, biotech, healthcare, for example, it is extremely important, that these companies, that means their R&D is really based on science. That they have really scientists who are really working to make sure that, they have proper drugs. I mean, just a few examples, right? Of course, like you've got big companies like Roche and Novartis. I mean, they are really excellent companies. They are, because they are large pharma companies that represent Switzerland, and they have many. I mean, they have really many scientists who are actually looking, to push their drugs, for or therapies to the patients out there. Okay, that's very important. But for many other, say, startups, they may not actually have this luxury. So that's where, the job of analysts have to come in. Yep. You have to talk to them very properly. You have to really interview them. You have to really ask specific questions. What are their therapies, or what are their drugs that they are, or medicines that they are selling, or they are developing for the people? Because I've come across several very interesting entrepreneurs who come to me. I do ask myself questions like, oh my God, is it really gonna work? But because my first degree, which is actually my bachelor degree, is in engineering, so I've always had a scientific background. So because this is something I learned from on the first day of my university study, actually back at National University of Singapore, was that you always, as a scientist or engineer, when we are confronted with, we will always be confronted with people with many so-called crazy ideas. But we should not just be close-minded and immediately already reject them.
Yeah.
That's one thing.
But so according to which particular criteria do you then evaluate it, like concrete?
Now, for me, I have to make sure that, first of all, the companies, perhaps actually some of the science that they develop actually have been discussed in peer review articles, scientific articles. That's very important for me as a kind of actually indicator of the importance or the relevance of what is happening. That's very important for me. Now, that's one point. Second thing, in collaboration with maybe other scientists that I will also work with, because as I've been working quite many years actually with Bank Julius Baer now, I have a very good network of external, I would call them colleagues from that sense, even though they are not hired by Bank Julius Baer, but much more actually like different stakeholders. They can be scientists, academics as well, and then we can actually look together to assess how good are their science, because that's very important to make sure that all these science or are really science-based. Second thing, I will also not just look at the science part of the thing. I will also look at the way how the company spends their money financially, because that's also very important too, because a lot of us actually, of course, tend to look into the importance of science, but also it's very important to see how some of the entrepreneurs, how they spend their money. I think that's very important also to look out for. So all these things you can actually very easily get by...
When we talk about these companies here, which exact type of company in longevity do you mean right now?
Sorry?
Which type of company are you talking about right now for longevity?
Some are biotech companies. Some are nutrition-based company startups.
Right.
They do come up with some, for example, like that require them, say, for example, they provide some nutrition-based drinks and beverages that is actually packaged in so-called, like, based on science, right, on scientific research.
Right.
Yes, exactly. So these actually are some of the things that is very important for us to make sure that, maybe what they are doing is really conforming to science, because some of the clients or some of the investors out there might actually say, for drinks, for health, why not actually just drink water? That's the healthiest, right? And it's
what do you respond to that?
It's not expensive. So I have actually come up with my own philosophical answer to this, in the sense that I would say actually that in the real world, 10 to 20% of the world's population have self-discipline. Okay, but for the rest, majority, most people actually have no discipline in how they have to improve.
Those are the ones that eat potato chips every day, right?
Oh, voila, exactly. So that's where maybe some of these companies could have, maybe for these individuals to lead a healthier lifestyle instead of actually the absolute healthy lifestyle, So that could potentially be.
Yeah, you touched on an important point. It's not about it's healthier than water. It's about nudging people to drink some vitamin water that tastes good and tastes maybe artificially sweet.
Exactly.
Is that what you mean?
Exactly. Like, say, for example, like it is, just take an example, right? I mean, some people love to drink orange juice, but orange juice has a lot of sugar in it as well.
Yeah, it's
exactly.
Actually quite unhealthy, yeah.
Yeah. Compared to, say, maybe some of the nutritionists out there, of course, they will have actually their own very qualified opinion on this. But say, for example, the difference between drinking squeezed orange juice and that of eating the orange juice itself is very different. Because realistically, how many oranges can we eat, right? And also when we eat eat oranges, there are still at least dietary fiber, which is actually good for digestion. But when it comes to drinking, pure drinking, it's actually lots of sugar in there. But at least for the individuals, people who want to adopt a healthier lifestyle, by nudging them to say, hey, you create already a kind of like awareness about the importance of actually leading a healthier lifestyle, instead of actually telling them, hey, just drink water. because some of the people might not actually be leading a very healthy lifestyle, and we tell them actually to do this complete, transformation to adopt a very absolute,
It's going to last 2 weeks.
Exactly, much longer, right? So I think it will be very difficult. So from that philosophical perspective, I can actually say that when it has an impact, of course, and ramifications for investment opportunities as well, because that's where for the 80% or more, people with, these companies could potentially, of course, have these as.
So in that sense, companies do not necessarily have to develop or invent a new drug, even the ones that have maybe a product that just nudges people to healthier lifestyles is already an ROI, right, for humanity. Mm-hmm. But I think a really important part of this conversation here that I want to specifically know about is more the investment approach. You mentioned already scientific backbone is important, but not every company in the longevity field will have scientific articles, etc., because their product is maybe different. So when you talk about these intangible assets, how do you as Julius Baer define whether a company is worthwhile to take a closer look at, invest in?
I think it's very important. You rightly mentioned, because there are different kinds of companies in different sectors underpinning, say, for example, the overall longevity space or the future health space, right? Say, for example, like in healthy living, is very different. Is quite different from, say, genomics, because genomics mostly are just the large biopharma companies. So naturally, for these companies, biopharma companies, of course, the main products are drugs, medicines, or therapies, and very scientific based. But when it comes to say, which is for digital health, there are some nutrition companies, or there are some sports companies, sports companies like running shoes, or wearables, for example. So it's very different. It's a different beast altogether. And then when it comes to external longevity, there are also the part on financial companies, right? Which is like, the life insurance companies, because these actually don't have scientific papers from that perspective. Now, having said that, so to analyze each of these companies in their respective sectors, what we do actually is that first of all, we have to find the relevance of the exposure of the companies basically on their business model, or the revenues of these companies. Where do they primarily come from? Say, for example, just to give an example, a very good example is some of the obesity drug companies out there. If their drug pipeline, I'm just talking about the pharma companies first. Now, if the main or the bulk of the revenues come or stem from a particular kind of drugs that they sell to the patients or the consumers out there, then this exposure to that particular drug, of course, is very important. This is the way how I would assess the company. First of all, as a thematic research analyst, I would do from a top-down perspective, the importance of actually, of the industry, say, for example, on the obesity space. What are the trends, right, of this particular health condition, and in which country, for example, globally, the country base. And then we can actually also beginning to look into the companies that are involved in the production or in the R&D of this space. Basically, there are two key players out there, I would actually say this, which is Novo Nordisk from Denmark, and also, of course, Eli Lilly from the US, because I think most people actually are aware of these. And then I have to look into how, these two companies differ. For example, in the case of Eli Lilly, is actually a much larger company based in the US, with larger market cap, and it also has actually a much richer or wider drug portfolio. I have to look into that, what kind of drugs or in that portfolio is. That means the drug pipeline or product pipeline is the word. Yeah. So, and then at which stage of them are they in? Now, to invest in healthcare-related stocks, it's very important to also note that quite a lot of the very often, I wouldn't say all the time, but actually, like say, stock movement very often is actually quite news dependent in the sense of actually that if the drug, say from a particular phase, clinical trial, either clinical trial 1 or 2, if they were to fail their trial, this has a material impact on their stock price. So this is actually a very interesting thing that we have to take note of, which is very, so when it comes to the pharma space, okay, this is how things work. And then for others, say, for example, when it comes to, say, say financial companies or, the investment opportunities for financial companies, then we have to look actually much more at the macroeconomic environment, right? So it's actually a little bit different for each different sectors.
Right.
But if we were to stick to just on the healthcare side of things, it is very important to look into the drug pipeline. I mean, it's the product pipeline of the companies, right? I mean, then we see from there how it works. Some companies that I've come across, they are listed on the stock market, but they don't have actually a very rich drug pipeline, in compared to, let's say, the much larger companies, say, for example, Roche and Novartis. Because Roche and Novartis typically actually have much larger drug product pipeline compared to, say, very small ones. Some actually even have like just 1 or 2, very interestingly, 2 or, very few products in their drug pipeline. And these ones, say, for example, then I have to actually then dig deeper, like, where do they sell the drugs, the medicines? Is there like a need for these kind of medicine?
Yeah.
And then I have to find like, is this making what kind of, money, how much money, the financial side of things, how much they're selling, maybe per dose or per, so this kind of thing I have to take into consideration. And of course, it's very important that if you have to talk to the responsible people who are working from a company to assess. Yeah.
When you talk to these responsible people, founders, or let's start maybe who you talk to first of all, and what do you assess in their information that they give you?
We cannot get any private. Non-publicly disclosed information. That one we will never do. It is actually very often very macro kind of information that I will get. So it is not as if they will give us private information. This is for sure not allowed, by the way. So much more for me important for me to know actually, like, for example, when it comes to the drugs or medications, what kind of therapeutic areas are they solving? For the patients or for the particular group of patients, and who are they targeting, like the geography, the geographical footprint, where are they selling their products? Okay, these actually are very important questions to answer. Yeah, because that also plays an important role in terms of the profitability at the end of the day too.
Right. So you do start with a sort of macro view.
Yes. Yeah.
And then you dive into the specific company.
Yes.
When you had, let's assume we have a new, scale up. It's startup phase already done, many successful investment rounds, and it comes on your radar, on your table. How do you proceed before making the call, this is a good investment?
I mean, for companies that have just raised rounds, maybe, but it depends actually on the market cap size, no? Because some of the market cap actually quite small, right? In this particular case,
let's say test reaches threshold, so it becomes relevant for you.
Okay, for me, let's say for example, a company. Just an example. Okay, let's say for example, a company manages to surpass $2 billion. Okay. Or maybe just 1.5. Let's put it $1.5 billion because ideally it should be $2 billion because then it's actually large enough for investors out there because usually small cap companies can be quite volatile in terms of their stock prices, right? So let's say for example it's $1.5 billion. What I would do is to compare this particular company, this particular stock, look at the drug pipeline or what kind of the product that they actually have, in comparison with the other companies in underlying actually, say for example, in my genomics, just an example, compared with others. Maybe there's a particular therapeutic area that is actually quite unique. Very good, just an example, because maybe a company that is dealing with bile cancer, because not all biotech companies are developing drugs to tackle bile cancer, because cancer is very broad, right? Because there's so many different types of cancer, because from skin cancer to colon cancer to all sorts of cancer. But then a company specifically dealing with bile cancer, just an example.
Right.
So for diversity, not for diversification purposes, I could actually consider, say, oh, it could be very interesting for this kind of company to be considered. So that could be very interesting for me to. So that should answer your question actually about that from the investment side of things, right? So it could be very interesting. Yeah.
There has to be some unique angle that they're taking that another player has not done yet.
Could be, yes, potentially.
Or they do it better in some
Exactly.
way.
But then that's where you have to look into, say, for example, like companies that have published, for example, their scientific papers in peer review journals, because that's very important, to be honest, because those are actually a yardstick for, to determine actually whether this company, the potential of the drugs, right? Because to really invest in, say, biotech in healthcare, I think it's very important that the investors be very well acquainted with science or with the medical science, the development. I think that's very important. At the end of the day,
Let's go specifically into genomics.
Mm-hmm.
For the audience, genomics studies the full set of a person's genes and how genetic variation affects disease risk, diagnosis, treatment, response, and prevention. The impact is fundamental. With advancement in genomics, many age-related diseases like cancer, cardiovascular disease, neurodegenerations, metabolic diseases can be detected earlier or treated more precisely. Where is genomics most investable today? Sequence, diagnostics, therapy selection, gene editing, and where do you see the largest opportunity in the upcoming future for a new company to create clear return on investment?
Excellent question. I think when it comes to genomics, some of the exciting space, okay, maybe I have to start this one by saying, since COVID, or during COVID times, there was huge investor interest to invest in healthcare stocks or healthcare-related stocks, including, of course, genomics, biotech stocks. It was huge. But since 2021, or 21, I think, roughly, then it began the so-called biotech winter. So what it means basically is that investors start shifting their focus away from biotech or healthcare-related stocks, right? Because why? Because COVID began to settle down. So investors start to shift their attention elsewhere. And in particular, investors are beginning to actually look much more into the Magnificent Seven stocks, the tech stocks, right? So this is actually very clear. So the investor focus actually much more put onto the AI stocks and then actually sort of ignore or maybe care less about healthcare related stocks. Now, when it comes to, beginning, I would say since October last year, we began to see a rebound of the biotech sector, which is really good signs. Unfortunately, or fortunately, or unfortunately, we want to say that, this space has also come into question in a sense from the political side of things, because what is happening in the US in terms of actually, because, at the end of the day, the US FDA is one of the gold standard for drug approval worldwide, right? Because they're very important. It's still very important, or the world's most important drug regulator. So what is actually happening there, it has an impact, ramifications for the rest of the whole world. And then at the same time, when it comes to space, I mean, investment opportunities, there are also, say, for example, like other countries, say, for example, like China, of course, in Europe as well, of course, Europe, very important, are coming in terms, say, for example, like in China's case, they have actually like the speed. They can actually, the approval process is much faster,
right,
and they can actually manufacture drugs at scale. That's important, but Europe is also very strong because in terms of innovation, that's very important. However, when it comes to, say, this is when I talk to entrepreneurs over the years, many of the entrepreneurs, even including in Europe, they go to the US,
right,
to further, to further develop their R&D, because first of all, in the US, the science is still at a very advanced level. It's really very...
Still today.
Yeah, still today, right? I mean, we've got lots of very preeminent universities over there. They're very strong in science. They're very deep specialists, know-how, talent pool as well. So the US remains very important. Now, this is actually, say, for example, the top, and they're very deep capital markets. Are very important as well. So it's much easier for a startup to raise funding. But that also has, because there's entire ecosystem, right? So that shows actually the entire, say, for example, ecosystem in the US is very strong. So that's why the company is also more interesting from the investment side of things, from that perspective. Yeah. So I would say that when it comes to investment opportunities, it is important. So we still remain actually pretty much actually like, say, exposed to the US, large cap companies over there in the US. US companies, yes.
So what separates a longevity company with real investment quality from one that is maybe scientifically impressive on paper, but commercially just too early?
For companies, okay, I think the question actually you might have answered yourself. If it's actually too early, that means basically at the end of the day, it is not easy for the investors to invest in the company, right? Or maybe they are not even large cap enough, I think.
It's so unviable, but you have to establish it first.
True,
right?
true.
How can you determine that?
Well, there are, okay, I know your question now. So I think it's important for the founders of this small startup company. They have to go out and look for investors and try to convince the investors about the importance of their research R&D, their product, their therapy. But for investors out there, they will have actually to assess it. Of course, like that's the reason, in my opinion, to invest in the space, you need to actually have a very grounded knowledge in the field, so that you can actually better determine the investability of the company. Now, because at the end of the day, over the years that I've met, all these entrepreneurs, they're all very passionate with the job or with their R&D. They all love their R&D, But the thing is that how they can actually translate that passion into, say, profitability for the investors, it could be a different thing, right? Because that's where the investors, when they come in, they have to really ask the right questions, So, as I mentioned earlier, it is not just about science. Of course, that's very important. Yeah. You have to ask actually about whether what they are producing is actually based or grounded in science. Yeah. Also important is, for example, like how the management of the company, for example, how they spend money, right, spend the funds that they have. So these actually are some of the important questions that I often actually ask the entrepreneurs that I meet over the years.
We're talking about business acumen here as well when you talk about the founders. Let's say we have a technical team, science experts. You still need that commercial knowledge and that financial literacy to know, okay, this is how we spend our cash, so we don't burn out and we don't go bankruptcy, right?
Yes.
So what would you advise here, maybe already to our fellow high-scale student founders that are interested in the health digital space, what is good management for you when we talk about scaling such a company?
Now, for scaling, for example, like, okay, first of all, it depends, okay, depending on actually the stage that the company, the startup is in. So if they have actually like a proof of concept that the product is actually, because they have to go to see the investors, they have to talk to the scientists, they have to actually to develop a proof of concept, and they can actually bring it much further, in the development plan, they have to start looking for the right, because at the end of the day, this sector is pretty much also defined by the talent that they have, the kind of people actually that they can bring the whole project forward. Who are the people who are needed? The scientists. You need to actually the CFO, for example. So you need to actually have people who can actually be able to communicate to the investors, because very often I feel that the scientists, they love what they do. They are very scientific. The bankers, of course, they have their own perspective as well, which is actually coming from a financial perspective. But I noticed one thing over the years. Sometimes when both parties come together, the language is lacking. You know why? Because one side comes across as too scientific, and the other side, if I may use the word, becomes actually much more like impatient money.
Too much finance, bro.
Yeah, so you need to actually have an intermediary, if I may use that word, the middleman or whoever, they can sort of actually translate. Of course, everybody's either talking in English or German. I'm not talking about the language, but much more about the technical form of language. Like,
right.
Yeah, the science to the bankers, for them to understand the science involved to develop the therapy, and for the bank, so that they can understand better, so that they can actually have the informed judgment to say, hey, I want to invest in the company. This is actually very important, because communication also play a role.
Very interesting point you're making here. We're talking about maybe very, scalable, businesses that have a really good product or some science-proven concept.
Yes. I know what you mean.
Investment bankers just don't get it. Right?
Yes. I came across actually some such companies.
Yeah.
They had problems convincing other bankers or the investors out there, simply because when they talk to the bankers or the investors, it is so scientific that the other party basically completely do not understand what's going behind, right? So sometimes actually they need to actually be able to. So that's why, in my opinion, or from my experience, I think this communication is very important. The so-called middleman, or what is the right word for it, that can actually adequately inform the investors what they are really doing.
That's why we need high-scale co-founders.
That's important. So that's really very good one. So I think that's very important to take note of. Yeah, that's definitely one of the.
But do you think that maybe we want to talk about investment banks, particularly, right, who do play a sort of important role, I think, still in, how, especially M&A activity, what could maybe potentially there be a trend that you see in the field of longevity in the upcoming years for M&A specifically?
As of now, I saw some data, relating to M&A activities, in a sense actually that compared to venture capital, there is not actually like a declining, say, venture capital into the space. At the same time, M&A activities are recovering. What it means basically is that investors are becoming more selective when it comes to early stage clinical assets. Because early stage clinical assets, by definition in a way, by default, they are riskier. because they have not really gone through, say, maybe clinical trial 2 or 3, because anything can actually happen disastrously, right?
Yeah.
So M&A activities are increasing, implying or basically showing, demonstrating actually that investors are becoming more selective, because usually it is more later stage clinical assets. So there's actually like the risk is a little bit more managed, or so we do see that happening. Now, some of the very interesting development in the space, it comes also to the space of neurology. Some of the health conditions related to it actually, say, for example, like Alzheimer's, for example. So this is actually very important to mention this as well.
Right.
You've got also, like, say, oncology space, which is cancer, which is very important and very big space. The cardiovascular space as well. So I would say that actually going forward, I do see continued interest in this particular space. Now, just staying actually with Alzheimer, very interestingly, we often think that only the older people have Alzheimer. People who are above 65, actually, of course, the risk increases.
Right.
But there are studies out there that show that increasingly younger people under the age of 50
Really?
are beginning to actually have cognitive impairment.
Okay.
Some of that studies actually even come from Singapore, my home country, because I was really surprised to see actually that even in Singapore, increasing number of people, of course, it's not like compared to elderly, older adults, but still in terms of actually percentage terms, actually is also quite increasing. So that could actually be an impact. But maybe just to mention this, in fact, 8% of neurodegenerative drugs on clinical trial 1 stage, only 8% of this go on to be commercially available to patients. So can you imagine actually how much of 92% actually basically fail at the end of the day? Only 8% proceed on to become commercially available. So it shows actually that the amount of time. That's why at the end of the day, it is also about that investors also have to remain patient. It's actually quite a long-term investment strategy.
What I do get from this is that even as an investor, you can have a huge positive impact, but just be aware that it takes time to materialize. You will not get these fast, quick wins. And of course, there's a high upside risk that maybe this particular drug doesn't work, but the next one works. So as long as we have those risks in mind, then investors should make their decisions accordingly.
Definitely, yes, yeah. So good science takes time.
Yeah. Let's go maybe a little. I want to hear a bit more of your philosophical takes, Damien.
Okay.
You already had the perfect introduction. You already went totally into it. Let's turn that. If people live longer, the basic. I will go with an easy one. If people live longer, the basic financial model of life changes, right? What are the main implications?
If people live longer.
In the financial model.
Yeah.
Focus on that.
Okay. First of all, I think there's lots of discussion actually when we live longer, whether our pension will be able to afford us, like whether our retirement, when we go on retirement, actually whether it is enough to pay for our retirement lifestyle, because we live longer, right? So this is actually one important question, because I think I see this kind of discussion here in Europe, in Switzerland, for example, and even in Singapore. People love to talk about their pension funds, because in Singapore they have actually this, which is called the Central Provision Fund, which is called CPF. People love discussing about this topic all the time. Every time I read the newspapers, from Singapore, so, oh my God, wow, that's so interesting. But it showed actually the kind of people are really worried, or really people do think about this question. Now, having said that, I'm actually currently reading a book. I've not finished the book yet. I'm reading this book. It's in French. It is called Économie des âges de la vie. is written by a French economist at a business school in France. I've not finished the book, I have to really mention this, but it was a very interesting book. Why? Because the premise was that it took place, the discussion was based in France.
Yeah.
And the question was much more on, there was always a debate in France saying that the older adults, because they have a better life, they have better retirement, the retirees actually enjoy better life, whereas the younger people are struggling. So there's this intergenerational conflict. So that's the older people actually benefit so much more compared to the younger ones. So the question,
some have, yeah.
Exactly, but
Some.
there is also a concept which is the so-called intergenerational wealth transfer, right? Okay, which is actually it was estimated that by 2030 in Europe alone, roughly 3.5 trillion euros will be transferred from the older generation to the younger generation.
Yeah.
So it showed actually that because the discussion, according to the book, a lot of the discussion was based on the public side of things, that means the state side of things, right? But the private wealth transfer is actually also very massive too.
Yeah, so let's assume, Damien, as we enter the final stage of our conversation today, let's assume we live in a world where the average life expectancy is 100 years old. How do we uphold purpose and renewal in society?
Wow, that's a very deep philosophical question you've got there, Jan. Now, let's say, for example, if the median age is 100 years old, oh my, I think from government to society to individuals, we have to actually discuss about, like, say, is the life stage or the life cycle model still holds, like where we go to school, education first, we find a job, and then we, retire, and then that's it, Or it is actually much more like, say, even with older age, then we actually think about like, is this still the natural line of thing or argument, or it is actually like, say, while we work, we also study or education, or we actually take a few years of gap years, because imagine you have to work all the time every year until the age 100, or more before we can actually retire. So these actually are some of actually very, I would say, very transformational consequences or implications that could have on society and for individuals as well. So I think it's a very difficult question to answer, I must admit. But I think it will require actually, like, say, policymakers, or everyone to actually come in, companies, individuals, to come in and set, because for sure, if median age is 100, that means we all have to work much longer.
Probably. That will be the first thing that changes, yeah.
Yes, exactly. And we never know actually what kind of problems we might have actually when it comes to health, right? So, yeah, it's a difficult question.
Maybe with a glass of whiskey we can continue this.
Yeah.
For our fellow Husky students, what do you think, where will be the best career opportunities in longevity in the next 10 years?
It's a very difficult question for me to answer, Jan. You've asked a lot of difficult questions. Now, I think in longevity space, for high skill students, you are in a top business school in Switzerland, very preeminent. I think in the longevity space, it can be from education. Say, for example, teaching. You can go into entrepreneurship. Why? Because we are at this particular location, which actually fosters, entrepreneurship spirit for young people like all of you.
Start global, for those who don't know.
Exactly. Maybe start global with a Swiss identity. I think that sounds really cool, no? Yeah. So that maybe might be, of course there are many, I think it's very diverse, but maybe these actually are some of the two, that I could actually recommend.
Cool. maybe to have one more, what skills will be rare and valuable in this field when we look into the future?
You know, with AI, ChatGPT coming out, I think, in my opinion, I think actually that the human relationship will become even more important.
Yeah.
The social skills, the soft skills that we have. Because, I mean, ChatGPT still can't replace it, right? I mean, these values, right? I mean, they can actually, so I would say that, in my opinion, maybe that answers to your previous question, how high escape students are going to navigate this, right? So if ChatGPT could do a lot of the mundane tasks that we human beings can do, that means actually the human relationship part will become ever more important.
Right.
So I think then it means actually that in this direction, there should be more opportunities, or very interesting opportunities for the young people to explore going forward.
Cool. Well, thank you so much, Damien. I think this is the ending that we're near to. I think we have had a very interesting and diverse conversation here. We touched upon many important things. And not only did it provide me and the audience with some lens on how investments are shaped in longevity, but it also created new debates and discussions about very important things that we should talk about as we look forward for society. And thank you so much for coming. Thank you very much for your time, and happy to do this again.
Thank you very much, Jan, for the invitation. Thank you very much. Yeah.